may cause paralysis to one part of the body and the patient may find it difficult to move in bed. It is important that patients are positioned comfortably and correctly. It is important to change the positions of patients regularly so as to minimize the risk of skin breakdown, contractures, and chest complications. Range of motion exercises for the upper limb. For the shoulder joint, support the weaker arm with one hand under the elbow and the other hand under the wrist. Lift the arm forwards and upwards towards the patient's head as far as you can. Hold for 20 seconds. Remember not to pull the arm or force a stiff joint. Always watch for pain. Next, with the same hand positions, bring the arm outwards away from the patient's body. Hold for 20 seconds. For the elbow joint, with one hand supporting the elbow joint and the other hand holding onto the wrist, bend the elbow by bringing the wrist to the shoulder as far as you can. Next, straighten the elbow as far as you can. Next, with the same hand hold, turn the forearm such that the palm now faces down. Turn the opposite direction so the palm faces up. For the wrist, support the part of the forearm close to the wrist with one hand and the other hand with your other hand. Bend the wrist forwards as far as you can. Bend the wrist backwards as far as you can. For the fingers, bend the fingers and wrist forward as far as you can. Next, straighten and stretch the fingers and wrist backwards as far as you can. Remember to stabilize the wrist joint. With one hand, support the fingers and wrist. Move the thumb away from the fingers and back towards the fingers. Next, move the thumb forwards and away from the palm as far as you can and bring it back towards the palm. Next, bring the thumb forwards and round to touch the base of the fifth finger and back to its original position. Some important points to note. For all movements, try to encourage the patient to participate together with you to try to increase the muscle activity of the weaker limbs. For all the stretches shown, do not bounce or jerk the joints. Instead, maintain a sustained stretch. Perform the movements slowly. Ensure that the joints are well supported. Do not move the limb just by holding onto its end. Always monitor for pain and discomfort. Never force a joint to move beyond what it can. Instead, take the joint gently to its limits and sustain a comfortable yet firm stretch. Please consult a physiotherapist if you are unsure of the exercises shown. Ask the doctor for a referral to a neurological physiotherapist. This is available in all the hospitals in Singapore as well as rehabilitation centres in the community.